How you doing? My name is Dr. Rodriguez. I'm a family practice doctor in Dallas, and I've been doing acupuncture for 20 years. The acupuncture is poorly understood, although it is one of the most profound tools humans have ever created with our technology, our creativity. A couple of days ago, I treated myself in this area and here, and I was brushing my teeth, and I felt a little twinge go up this way. So I'm gonna chase it this way now. I'm gonna cover this and go here all the way back here and in the back of my neck. That's the plan. So depending on what I feel, depends on what I do next. I'm gonna do a different attack this way. So here we go. I am going to go. There's a ridge right there. So I'm gonna go right at that ridge. And so acupuncture is massage with needle tips. So you massage with your fingertips and your needle tips. So the action of physical therapy, muscle therapy, is effort, force, elbow grease. And the action of the needle is mostly the tip. So the tip is the leading edge of the mechanism of action, and it breaks up, ruptures, pops. That's the acupuncture needle. The hypodermic needle, and I might do a video on the hypodermic needle using the same techniques. This is a blunt tip, so it ruptures muscle cells. The hypodermic needle cuts through the muscle cells. The hypodermic needle is more capable of slicing through the tough stage 5 beef jerky muscles that are hard. And sometimes the muscles are so dense and tight, you can't even get an 18 gauge needle through the tissue because it just bends the tissue. It's just it's almost like a flak vest. So, and instead of going straight in, I'm going to angle it up this way. Why? Because this is just one of the techniques I use. And you can see it's not going in properly. It's stuck on something. Well, fibrous tissue. And I'm gonna go here. And you get a little pinch, but it really doesn't hurt. Now, some do hurt, and it may cause you to zing. If the zing lasts for longer than a second, and it lingers, and the patient requests, I'll take that needle out and do a little cotton ball rub, like you're scratching an itch. So I'll take the needle out and just kind of do that to get the sensation to go away. They appreciate it greatly. And until you feel it for yourself, it's inconceivable what it feels like. So you have to feel it. So all this is feel. There is a method. There's no madness. There's a method, and you just follow the method. Before I understood what I was doing, it was madness method. Now this is just systematic method. Ooh, that's a yucky feel right there. I'm going to save that one. Now, when I do that, that feels like the spot because I can sense it go up this way and down this way. Whether it is or not, whether it's a like a spider's web, and you hit one part of the spider's web and you feel it over here. It doesn't matter. The goal is to apply enough therapy so that the web, the dendrite, the matrix, the screen disappears, gets reabsorbed in the process. So this is one of my long ones, and I'm going to do this right there. And yes, that hurts, but it goes away quickly. I'm gonna push that. There's something there. It's a blockage, a knot or something. And I can feel it go this way. And, ooh, now that's a good spot too. Well, I say that. But I feel something. But whatever you feel is truth. The results will have to be determined after it goes through a healing cycle. And a healing cycle usually takes 1 day to 4 days to 5 days. But once you go through a healing cycle, then you can get feedback, and the patient will say, that was it, doc. And you just repeat it and repeat it until the patient feels 50, 70% better. Then you can back on the force. But until you reach the force of activation, and once it starts to activate the healing cycle, then you keep that force there, whether it's, and this is just a guide, 10 to 300. So if you can release it at 100, then you keep it at 100 until the patient is 50, 70%, 80% better. Then you hold it there until it's stable. You can decrease it or increase it. Sometimes increasing might get like if you go from 100 to 200, you might get a benefit. Patient might say, doc, I think that's better. So you stay at 200 until 70, 80% better. Then you can slowly drop it. Some people have to go up to 300, and you give them 200 and they don't budge. It's like, I don't feel nothing. You got to go up to 300, just like you treat cancer. So you match the dosing with, I can feel that across there. So if I go this way, I had to go, but if you go this way, you have to use 20 needles. But if you go this way, basically you are sort of like putting your hand in a sandwich, or between the covers. Instead of going through the bed, you go through the covers, through the layers of the covers. The mechanism of action, again, is the needle tip and the needle. Deep, rupturing the cells, spilling out blood, and within the blood, when it bleeds, you get platelets, progenitor cells, stem cells, all the healing elements, the ones we have no idea exist. We don't worry about that. What we worry about is doing it and letting the truth come out. And the truth only can come out by the patient's testimony. Without the patient guiding you, you are literally going in the blind. Why not just ask the patient? They're there. Just ask them, oh, how's it feel? They'll tell you. You just follow their lead. And if you find a protocol in a book and you use it, but the patient you never ask the patient how they feel, then that's blind. That is, I would call that, there's a word I'm looking for. It's less than honorable. It's the wrong way. So I'm going to probably put some across here and then finish across there. But I'm going to put one. This one usually zings the dickens out of me. Let's see if I can get it in there. Ooh. And if you use a fresh needle, it'll just slide right in without too much. I'll reuse needles until they get flat. And when they get flat, you'll feel it's like, eee, and then you just throw it out. I would hate to be in the 70s and 80s when they had to polish these and resharpen them. That would have been traumatic for me to even do. And I'm feeling my way through. So I can feel here, the acupuncturist. The patient can feel here, and they'll give you, and you can train them or teach them how to give you feedback. Feel back. There's feel back and feedback. All truth within the patient's word. Whatever you feel is irrelevant at that moment. Once you feel something, it's gone. Life is continuous. The therapy is continuous. There's no static in this. If you write it down, it's worthless. You feel it, it's gone. Mother Nature has already begun the healing process. So this is momentary, and then Mother Nature will do her part, and then you keep doing it. There's no static in this. There's no recipe. You flow along with it, and the patient is the only guide. If you allow the patient to guide you as to what you can do, then you are a loyal servant. People cannot figure this out. You can begin and let the mastery and the patience guide you on what to do. If you don't include the patient, and you knowingly or unwittingly don't include the patient, then there's an element of deception. Just tell the patient what you're doing, how you're going to do it, and you need their help. They'll be glad. And once you teach them, the next time they come in, they'll have a list for you, and you just, whatever they need. The other part of this is not just this. Trigeminal neuralgia is not just this. It's all of this, all the way down to your top of your head, to your soles. And you have to cover all of that. Every pain is in every cell in your body. Don't discriminate. Just attack. Just like you would cancer. You wouldn't stop cancer therapy until the end. You don't stop pain therapy until the end. The patient is back to battle ready, or you have to decide something else to do or add something else in. As long as they're coming back and as long as they have the need and they can feel the need, you just honor them. That's it. Any less is dishonorable. So I'm going to put this one so it's gummy there. You can see how it's sticking. And in theory, a fresh muscle is like filet mignon. You put the needle in, it just glides in and it glides out. You get no feedback, and it's just fresh. It's just alive. But when you see elements of this, there's something wrong, possibly. The only way you'll know is to do. And as you keep doing, the truth will expose itself. But the patient is the only person who can tell you that. Without the patient, you're less than honorable. And why be dishonorable? Just tell them the whole truth and the whole story, and then you're safe. Any less, again, it's dishonorable. So I'm going to finish this up, and I may come back later. And depending on how it feels, sometimes I'll just do that and kind of stimulate. So it's stimulation, and thank you very much. If you have any questions, you can follow my links. They're all there. Thanks.